Hi, I'm Dr. Scheibel. I'm going to talk to you today about ear infections, a fairly common thing that we see in kids. Kids are much more prone than older, adults. Sometimes adolescents, teenagers, older kids will get them, but babies especially are fairly prone to ear infections. What an ear infection is some pus behind the eardrum in the middle ear space, which can cause fever, pain, trouble sleeping. They can be really tough for these little guys. So what we recommend is if your child is just pulling on their ears and fine, that's okay. But if they're pulling on their ears, they have a fever, they're really cranky, they're not sleeping, any of those things and you're concerned, bring them in and we'll take a look. When we're looking, we look to see, is there fluid behind the eardrum? Is the fluid clear, which is pretty normal and can go away? Or is it thick and kind of, a little bit of pus back there? In that case, if they're younger than 2, we usually put them on an antibiotic to help it clear up. If they're over 2 and doing okay, not having high fever, sleeping all right, eating and drinking okay, then we will often just watch it because a lot of those will go away on their own. But again, if they're younger, we definitely want to see them so we can take a look and see if they need antibiotics to feel better. If you have any questions or concerns or think your child might have an ear infection, call our office so we can take a look and see what's going on. If your child is diagnosed with an ear infection, seen in our office, then as long as they're fever-free, they can go back to daycare. One other point, which often comes up, if your child all of a sudden wakes up in the middle of the night with ear pain, what can you do? So rush them to the ER? I probably wouldn't. That's usually not a great idea. I would give them some Tylenol or some ibuprofen or Motrin, give them something to drink, try to get them back to bed. Sometimes you can even put a drop or 2 of warm olive oil in that ear and then call us in the morning if they're not better and we'll take a look. If you have any questions or concerns, give us a call. Thank you.